Good evening, everyone. Welcome to the Sina Magowitz Foundation's second virtual event. I'm Miranda, and I'll be your host for the evening. Now, as you may know, we made the tough but necessary decision to go virtual for this year's events for everyone's health and safety. But that doesn't mean we're sitting on the sidelines. This year, we're bringing you a series of virtual events to continue the fight against pancreatic cancer. Now we'd like to introduce you to a pancreatic cancer warrior with an incredible story. Janet Bohr was diagnosed with the disease 3 years ago. Now since then, she's been fighting a courageous battle and has taken part in a key clinical trial at Honor Health. We have her here with us today. Hi, Janet. Thank you so much for joining us.
Hi, and thank you. It's a pleasure to be here.
Now, Janet, pancreatic cancer symptoms are usually silent until the cancer has spread. So what concerned you enough to go see a doctor and led to your diagnosis?
Well, what concerned me was the fact that I turned yellow. I was told by my mother's caregiver that I was yellow, to which I said no. And it turned out, indeed, I was very yellow because I had a backup of bilirubin. And my skin was yellow, my eyes were yellow, and it was that led me to a procedure on the 5th of July of 17 to have a stent put in to relieve the excess bilirubin. And it was at that time that the specialist that put in the stent discovered the cancer on my pancreas, which was at the head of the pancreas, and it was about the size of a quarter.
And after that diagnosis, you ended up participating in a clinical trial at the Honor Health Research Institute. Now, how did that trial give you hope in going forward with this diagnosis?
I think the first meeting with Dr. Bohr, as he explained what the trial was about and what my choices were, which was to do the normal treatment for pancreatic cancer, which did not have a significant amount of supporting data that was positive supporting data in terms of outcomes. And then looking at the data that he presented about the trial that was in progress and the significantly better outcomes that patients were receiving. So that was my first step. Then the second was after I decided to join the trial and had my first encounter with the entire staff, I was so just blown away by the professionalism, the empathy, and the fact that every single person that I interacted with during that entire process, to me, was the epitome of the patient experience.
That's amazing. And then the trial was successful.
Yes, I went into chemo in September. I finished in December. And then after they looked at all the blood work, it was determined that I did qualify for Whipple surgery, which I had at the end of January of 2018.
You had a good experience with Honor Health. What has been your experience with the Sina Magowitz Foundation?
Again, since this whole journey began, in meeting the people that are working toward finding a cure for pancreatic cancer, it's an amazing experience. Roger's mom, unfortunately, passed from pancreatic cancer 18 years ago. And it was at that time he decided to start the foundation. And the work that's done and the tireless effort that a staff that, by the way, the majority of them do not get paid, and the work that they do and the success and the relationships he builds with donors, supporters, and other organizations in the research realm, specifically TGen, which is in downtown Phoenix, led by Dr. Von Hoff, who developed the pancreatic program at Honor Health. The work they do is phenomenal, and he's tireless. I mean, the whole staff is out there constantly, and the fact that when something like COVID presents itself and you can't do the big in-person event, life is getting creative, and we're doing virtual things like this, which is amazing.
Yeah, and thank you so much for being a part of it. And how would you encourage people to be on alert for those subtle symptoms that most people might miss?
Well, I'm not a clinician, but I'll tell you what, I'm going to give you some things that I've researched and what I've read. But if you are obese, if you have been diagnosed recently with type 2 diabetes and you're rapidly losing weight, that's a concern. If you smoke, if you abuse alcohol, that's a potential. If you have genetic likelihood, meaning you've had a number of members of your family pass from pancreatic cancer, those are some of the hints. But I think what the most important thing is, go out there and read. And don't be afraid to challenge your physician. Don't be afraid to ask a million questions. And don't be afraid to ask for a second opinion. Now, where did I find my data? I found it on the TGen website. I found it on the Magowitz website, and I found it on the Honor Health website, because part of what they do is educate people in terms of what do you look for, what symptoms do you have, and now there are genetic testing procedures, like if you are genetically prone for pancreatic cancer, they can test to see the likelihood. The BRCA1 and 2 gene is one test. I remember going through that, and it's nothing. I mean, it's not painful. But, some people are afraid to know. I'm the opposite. I'd rather know so I could deal with it than go down the line later and have somebody say, congratulations, you have pancreatic cancer. That's not a good choice in, my thinking.
You talked about education and advocacy. Why is fundraising so important in the fight against this disease?
Because research is expensive, and research requires a huge number of people. It requires many hours, days, months, and years of work. It requires multiple levels of testing. Some clinical trials are successful and others are not. But with each trial that they're funded for, they learn something from that trial. So, pancreatic cancer has always been kind of written off as that's the one that'll kill you, and there hasn't been a whole lot of attention paid to it. It's starting to now move up in the food chain of attention, because the work that's been done around breast cancer has been so successful. The work around prostate cancer has been so successful that pancreatic cancer is going to move up into one of the top 3 devastating, life-threatening diseases that we're faced with today in the realm of cancer. So the research is critically important, and it takes money.
Thank you so much for sharing your story with us. You have such an inspirational and incredible story, so we appreciate you being here today.
And thank you. I appreciate being asked.
Now we would like to honor one of our legacy heroes in the battle against pancreatic cancer, the hero who began our work, Sina Magowitz. In 2001, Sina was diagnosed with late-stage pancreatic cancer. Knowing little about this type of cancer, her son Roger expected the doctors to explain treatment options. Instead, fear set in when they told him his mother had just a few months to live. Time became the enemy. "There's nothing we can do," was all the doctors could say. His mother soon passed away. His initial anger turned into an undying commitment that no one should ever hear those words. That's what set the wheels in motion for the creation of the Sina Magowitz Foundation. Roger's mantra became, "If not me, then who?" He committed to raising meaningful dollars for innovative medical research, easy methods of early detection, and viable clinical trials. The foundation launched in 2002, and we are thankful to say that from its launch, the average 5-year survival rate has almost tripled, from about 3.5% to 10%. Every year we get closer and closer to finding the pathway to a cure. And when that cure is found, our donors can be proud that they helped lead the way. In loving memory of Sina Magowitz. Roger is joining us now. Roger, when you talk about your mother's story, you often reference removing your wristwatch and tucking it away as if time could stand still. Can you explain your feelings at the time?
Well, I certainly wanted time to stand still. I knew every time that minute hand would move on my watch, that would be less time I was going to be able to share with my mom. So one day I just packed that watch away. I haven't worn a watch since, and hope one day to be able to pull that watch out as we move further in the cure for pancreatic cancer. Time was our enemy then. Time is our enemy now. I can't state the saying any more than if not me, then who? We all have a chance to make a difference. Please make a difference today. Please donate to the Sina Magowitz Foundation. Help us help these patients that are in desperate need of new innovative clinical trials. Thanks so much for joining us.
Roger, thank you for sharing your mother's story, and thank you for all that you do.
Much appreciated.
These stories remind us of the importance of raising money for pancreatic cancer research. One person who's gone above and beyond to support the cause is Camille Moses. Camille is a pancreatic cancer warrior herself. On her first diagnosis, she was given only a few months to live. She defied those odds and is now an 8-year survivor. Her story has become an inspiration for thousands, even appearing on national TV. Camille is joining us today. Hi, Camille. Welcome.
Hi. Thank you for having me.
Yeah, thank you so much for being with us. Now, what led you to get involved with the Sina Magowitz Foundation?
Actually, it's kind of a funny story because I was sitting here one day scrolling through Facebook, and I saw a picture of the most beautiful woman who was a single mom, and she was battling pancreatic cancer. She was a doctor. Her name was Dr. Jill. And I never got to meet her, but her story resonated with me because I had been a single mom. And, obviously seeing a single mom, she was young, she was a doctor herself. And that kind of drew me. And I'm like, who are these people? What are they doing? And I reached out to them, I messaged them, and I told them my story. And I immediately, they, showed interest. I sent over the written story that I had written up, just to kind of my story. And then I said, oh, well, I have a couple videos too. And then I sent them those. And then Roger called me, and that's kind of been history since there. Roger and I have become close, and he's dedicated his life to this, and I've dedicated mine. So it was just sort of a match meant to be, I think.
Awesome. Well, I know he sees you as such a huge supporter and friend of the foundation. And what gives you the strength not only to continue to fight pancreatic cancer, but also to be an advocate for other patients?
I never set out to be anything. I went through a really bad experience. I was diagnosed with stage 4 pancreatic cancer. I had cancer in my pancreas, liver, and lungs. My liver was completely full of cancer. It looked like someone took a black marker and filled it in. It was really devastating. I was petrified. My mother had died of pancreatic cancer, so obviously, I knew I was in a lot of trouble. But for whatever reason, thank God, because of good chemotherapy, I'm here today. And I started to share my story just at my local cancer center here where I was treated at the University of Miami. And it just started to catapult from there because people heard like this wonderful, amazing story of someone who survived pancreatic cancer. I had full response to chemotherapy, and I haven't had any treatment since 2013. So obviously, it's really important to me to show patients because there was really no one for me to take the cue from. So it's important for me now to show patients that, hey, you can do this. There's great treatments out there. You just have to find the right team, and you have to find the right place. And because of, someone like Roger, Sina Magowitz, they've raised so much money that all these trials I've met, so many of their survivors that, are so inspiring, and then they want to share their stories. So I really have this huge community now of survivors of, this terrible disease that I want to make a difference somehow.
And you are making a difference. And I know you said you haven't had to have treatment since 2013. How are you feeling now?
I mean, I have, thank God, no cancer in my body. And I am healthy. I'm 61 years old, and I'm very happy to be alive. I'm happy to be healthy and do all the things that, obviously due to COVID, I'm high risk. I still have low white count. So I'm pretty much still staying home. But I'm happy to be home. I'm happy to be alive. I'm just really, really a grateful person. I'm just grateful for where I'm at right now.
Well, that's beautiful. Thank you so much, Camille. We appreciate your support and we admire your strength.
Thank you.
And we do have one exciting announcement. We'll be doing a virtual bingo night for our supporters, friends, and anyone who'd like to join us. That's going to be on Wednesday, October 21st, and it'll be a fun, family-friendly event. You can find all the details on that on our website. And as you've heard throughout this event, time is not our friend. The time to do something is now because these patients need your support. Roger says it best, if not me, then who? Right, Roger?
Correct. That's been a slogan of a foundation, and hopefully everyone takes that to heart and realizes that time is of the essence and each person can make a difference. So please donate now.
Thank you everyone for tuning in. We'll see you at the next virtual event. Stay safe.